वाली है क्योंकि to actually be a speaker against the motion in a hall filled with nurses is like saying "आ बैल मुझे मार." Correct? You know, so let us call up our first speaker, Dr. Saurabh Gahlote, who is the medical administrator. अच्छा ये तो मैं ही हूँ अभी. Okay, still मैं है. So Dr. Saurabh is the medical administrator, Sarvodaya Hospital. Do I need to introduce him? No. And he is one doctor who is luckily on the foresight. He is going to be loved by all the nurses. And then I have to balance it. So let me call on someone for who this next 40 minutes is going to be a little headache. So he is our headache specialist, Dr. Pravin Thomas. You know, and ये सर जब ऊपर भी आ रहे हैं तो मेरे मन में एक सवाल आ रहा था कि सुबह तो ये इतना फॉर बोलते रहे और अभी ये जाके अगेंस्ट के पलड़े में बैठ गए. But it requires a lot of courage. So loud round of applause for him.
सर यही इनके अगेंस्ट में भी जाने वाला है कि ये फॉर में बोलते रहे और अब अगेंस्ट में आए.
I said अभी मेरे को पता नहीं है बोलेंगे तो उसके बाद तालियां बजेंगी कि नहीं इनके लिए, तो तालियां अभी बजा देते हैं. No, nothing like that. I think, you know, for every debate, any debate or any discussion to be very exciting, you need both sides of the view. Correct? And then I'll decide कि one is their view, one is their view, and then is our view. ठीक है? Okay, so another loved nursing officer, Miss Josephine Cyrill. पता नहीं उन्होंने कितने फोटो लिंक्डइन पे लिए already. No need to introduce her. She is the proud owner of 26 photos taken with me in the background today. Which will be posted everywhere with consent duly taken. So ma'am is, you know, the nursing officer. See, I said medical. I'm already promoting you of, you know, Ganga Hospital, and you can read this. But this is not important. The next 40 minutes we want to hear what ma'am will say. So आपने ये पढ़ लिया तो I'll call up my next speaker for today, Dr. Rekha, Anil, Kumar. Another difficult one, you know, speaking on against the motion. ताली बजा लो भाई, अभी बोले नहीं हैं वो लोग. Okay, so when Madan is done with taking the snapshot, photo shots and all, then we start. So how many of you actually find these debate type and panel discussions very exciting? Raise your hand. सुनो पहले यार 4 choice होने वाले हैं. Choice A is I find it very exciting. Choice B is I am not even hearing like Bobby at the moment. Choice C is I don't care. मेरे HOD ने मेरे को भेजा है. So choice A, choice B, choice C. How many of you choice A? What about choice B? Bobby put your hand up 5x. Okay. And what about choice C? I don't care. अभी बता नहीं सकते बाद में. Okay, so we have some ground rules for this debate so that, you know, I don't want people going WhatsApping. होता है ना कभी-कभी. So the speakers will be abruptly shut off if they keep talking, which will never happen because the host only will not stop talking. No. I'm going to ask them a question. They have views. We take 3-4 minutes. Counter, punch, but we'll have it very interactive. Okay. How many of you actually think, before we go in, so that, you know, I intimidate the panel a bit, sir. Now look here. How many of you actually think nurses should be empowered and, you know, treated as equals? Raise your hand. What a dumb question, right? In a nursing conference filled with nurses, right? Okay. No, but you know, जैसे हर सिक्के के 2 पहलू होते हैं. Let's understand. We'll start with Miss Josephine. So you believe that nurses are equals, should be treated as equals, you know, and equal partners in healthcare. Why? And I'll be standing here only because, you know, it's easier.
Yeah. You can sit.
अरे वही तो नहीं करना है. आज बैलेंस नहीं करना है. बैलेंस बिगड़ जाएगा मेरा. मैं तो आप ही की तरफ हूँ.
Okay. So thank you, Dr. Clive, and thanks everyone for being here. Good morning, good afternoon now, everyone. So a very exciting topic. So equal and a collaboration for nurses. I am for it. So, you know, I have a few points which I have divided in four sections, which I will explain quickly because I have just 4 minutes. Let's look at Indian scenario. the first and most important challenge is getting good nurses on board. We are talking about equal forum. Getting good, committed nurses in your system. You need nurses. Shortage of nurses is everyday story. Number two, once they are on board, how you tune them to care aspect, care delivery. Today in every organization, I had the experience earlier also where nursing head used to struggle with HR for taking nurses on board. But I see there is a change. Today everyone in the organization is concerned about taking good nurses on board. I have seen today's time, in nursing recruitment, there is an opportunity is getting circulated among the doctors, among the top management doctors. People are all interested in sending their nurses for getting into the system, getting trained for trained nurses, that is in the nursing school and in the hospital section. Now once they are getting them on board, today they are not interviewed and tested only by nursing department. They are tested and interviewed by a board. That is what happens in our setup. Excellent combination of HR personnel, administrator, medical personnel, nursing head, school of nursing principal. Collectively you decide X person is coming on board. Now making that novice nurse to an expert. The complete training program is decided not by nursing alone. An equal importance is given. Training is done by dietitian, by physiotherapists, by clinical pharmacologists, nursing. A beautiful induction program is designed. Now hand-holding her in the workplace. Specialty nursing, specialized nursing training, all done by clinicians and other people, and nursing is there in forefront, the nursing in charges who are fully trained. So when it comes to care aspect, I want to focus on patients who are coming need acute care, they need chronic care, they need rehabilitation, and there is a huge aspect of preventive care. You tell me today for preventive care and continuity of care, who are the best people in the society? Nurses. And today in our country alone, the home care programs are all led by nurses. And they are not doing it alone. They are doing it in consultation with the doctors. And even in our setup, the entire home care program is managed, and the recruitment, training, and 100+ nurses involved in home care is led by a nurse. And full freedom is given to her. Of course, overall it's all checked and seen by top management. So what I meant to say, when recruitment, training and getting them on board, there is an equal importance given, maybe more importance given to nursing role played at every level, at care delivery level, and now coming to training and staff development. You know, today the training, specialized training, whether it is trauma nursing, palliative nursing, pain management, and any other specialty nursing, infection control program, we are sitting with the doctors, clinicians, junior physicians to attend the training program. So training and development, BLS training, PALS, NALS, all such a training to enhance our critical care competency. There is no difference. And nurses who are doing good in BLS are taken into SELS training. And who are the trainers for for the doctors and junior nurses? Nurses who have scored full marks in BLS, they are the trainers for them. So recruitment, training, care delivery, there is so much of importance given today for nurses in parallel with any other physician or a senior doctor. Now coming to coordinators. So many physicians today in the system need nurse on their right hand as coordinators. For collaboration, for coordination, for a patient who is getting admitted for a transplant, for a basic simple admission, for a daycare patient, and somebody who is diagnosed with a chronic problem, needing care at home, and palliative care, someone with a poor prognosis, there is no hope of survival, how to manage the difficult situation with the family. So again, preventive aspect, all managed by our palliative care nurses, all nurses who are trained and skilled in that. Another very important aspect, from morning we had been hearing about quality and accreditation. The huge role played by nurses. Today a physician can present a clinical audit or a nurse can present a clinical audit. There is no difference to it. I have seen nurses doing excellent clinical audits and quality improvement program presentations during assessments, even in your own setup. You need to just empower them. And today nurses, I do not agree that nurses are not fully empowered. You have to reach there. You have to accelerate yourself, as Usha was telling in the morning, Captain Usha was telling. We need to accelerate and reach to that stage that people will consider you. you need to upgrade, we need to upgrade our IT skills. I've seen young nurses with excellent skills in IT skills. They can do better graphs than us. They can do the formulas in the Excel sheet so well. Give them a chance. Competency-based skill recognition and giving them a chance. I think we are equal in collaboration and getting things done.
मैं खड़ा होके इस साइड आ गया because बहुत भारी हो गया था उस साइड. No, it turned very, very heavy, so I had to bring it here to balance it. So Miss Josephine is saying, जब इंटरव्यू में सब लोग बैठते हो, जब सब काम कराते हो, ऑडिट बराबर का कराते हो, सब कुछ तो सबके साथ कराते हो, तो सेम दर्जा देने में क्या प्रॉब्लम है? बट दे
सर ऑडिट बराबर का नहीं ज्यादा का करवाते हैं.
अरे अब तो मेरे को इधर आना पड़ेगा. It's turning very heavy. But they say लेकिन, किंतु, परंतु, but. There is always a second side to it. So let's understand from Dr. Pravin what, the headache expert. So why is he having a headache when we talk about, empowering nurses equally like the other people, from the man himself?
Thank you very much. And thanks to my short-term memory, I really forgot which side I am on. Because morning you said that, as you rightly said, I was on the other side. And now I'm sitting here, which is why I have a PPT over here. I'll just open that. Okay, so the question is, this is the question. The question is very clear. First of all, we have to understand the question. What's the debate about? Are nurses in India considered collaborators and equal partners? We'll start with that. Now, we have a problem here. And what is the problem to begin with? There is an epistemo-semantic incoherentism here. Let me make it very simple. Epistemology is the study of meaning, and it's a branch of philosophy. Semantics, again, what exactly is a word meaning and stuff. Incoherentism. And why am I saying that? The first question, are nurses in India considered? First question to answer is, considered by whom? Considered by physicians, or considered by nurses themselves, or by the paramedical staff, or by administrative staff, or by the public. So first thing we have to question and understand is the first question. Second is, collaborations and equal partners are not necessarily the same thing. Collaboration is one, equal partners is one. So here there's a question to be answered. Are they considered collaborators and equal partners? So let us now assume a few things. It's like a premise to start with. Assuming that we have a syncretic view, that is considered by whom I asked in the beginning. Let us say that they consider physicians, nurses, paramedical staff, administrative staff, public, everyone put together, a syncretic view whether nurses are considered by all of these people as equal partners or as collaborators. So I have put this in inverted commas. Are nurses collaborators? And are nurses equal partners? Now, so this is actually representing the present. Are nurses collaborators? Are nurses equal partners? There would be no debate if the question is being rephrased as, should nurses be collaborators and equal partners? Or will nurses in India be collaborators and equal partners? There would be no debate. But the question is, are they? And therefore there is a debate. Now for that we have to first of all understand the definitions. What is exactly a collaborator? A collaborator is a person who works with another person to create or produce something, such as a book. This is the Oxford Dictionary meaning of the word collaboration. And what is an equal partner? Equal partners agree on goals together and work as a team to achieve these goals. Now let us try to answer the question. Are nurses collaborators? Yes, they are. Of course, I should be probably sitting on the other side of the debate. But there's another question. Are nurses equal partners? Based on the definition which I showed you, yes, they are. Now, we have to explore some more concept before answering more. One, about equality. Second is a setting, and third is about partnership. First thing is, I remember when I went to when I'm in medical college, one of the administrators or IAS officer was there. I asked him about something, and he said, "Oh, now you're quoting Article 14 of the Constitution saying that everybody is equal." which means that I can say that the President of India is having a convoy with bullet bodyguards. Why am I not getting it? So that is not equality. Equality in Constitution of India defines two important things. So that is what is basically the principle of equality. States are equals are to be treated equally. Now, what is the setting in which we consider all this? Hospital setting, clinic setting, public health setting, and private sector, government sector. All of these points are to consider. Then there is the economics. For example, is it a capitalist-based setting? For example, is it overarching objective of the investors in a business, private, limited, various combinations of profit, customer satisfaction, charity, philanthropy, private versus responsibility, and then there's a socialist state-run, and then there are combinations. So there are evolutions and changes in roles. For example, historical context globally as well as Indian context, and cultural context, which is Indian. So this is the first book which Florence Nightingale brought out in 1860. And basically she talks about how exactly everyone is a nurse, every woman is a nurse. She plays a role of a nurse in her life and also people around. Historical and Indian perspectives, if you see, there's always been this historical premises played as equal partners or as collaborators. So the question now is, why am I sitting on this side? I'm sitting on this side for two reasons. One is because that's the topic that is given to me. And second, most important thing, it is contextual. So what is the most important thing? Increased specializations reflecting global trends. CSF nurse specialist, headache nurse specialist, Parkinson's nurse, because of a neurology perspective, of course, some other specialties, so many others. Make research a strong element from undergraduate training. Make nurse practitioner and nurse prescribers a strong reality. Make revalidation of nurse practitioners based on research and updated knowledge. And the outcome of that would be equal plus collaborators. Whether in hospital or clinic, with us there will be equal collaborators in research purposes, equal collaborators in nursing practice, equal collaborators in service excellence, and in public health at the national places, the equal collaborators in community development, equal collaborators in policy making, and equal collaborators as whistleblowers. And why? Yeah, so just this is what I want to, this is my last slide. You know what's the slide? This slide, which is going to show that I should be removed from this part of the platform is, and put on that side is, that is what's shown. The top 5 most revered professions in the world, the top 5 in that, the nursing comes number 1 for the 20th straight year. Nurses lead Gallup's annual ranking of professions for having the highest honesty and ethics, eclipsing medical doctors.
Yeah, now I have to come in as the moderator because this is not a presentation, this is a debate. And आप हमें तो पता नहीं कहाँ से कहाँ ले गए. मेरे को आनंद पिक्चर याद आ गया कि lymphosarcoma of the nose, because you said the epidemiology of the seismology, and from there you went to the constitution. लेकिन किंतु परंतु but he has still not said in one simple word, should they be considered yes or no? No. आप हमें परिभाषा के लिए
simple as should they be considered yes? Are they no?
So our panelist, he has presented everything contrary to what he's saying, but he's still standing by which is good.
They should be, but are they? They are not.
Wonderful. So this is, the whole idea is there have to be two sides, right? And we have to put up, it is very difficult to be on that side. And I realized that, so I came this side. Totally this side. Okay, let's come to Sir now. So you heard all of this, and you are sitting on this side. So why do you think? I really don't know, now I've forgotten collaboration ka definition kya hai after seeing that. But why do you think they should be considered equal partners?
So first, I'll speak both in Hindi and English. हिंदी में भाव ज़्यादा अच्छे से आता है.
अच्छा, मुझे पता ही नहीं था.
भाव की ज़रूरत इस वजह से I would like to thank Dr. Pravin for speaking for so long and still coming on our side. Thank you so much, sir. Second, the thought which was coming to my mind was, I think sir should also have Dr. Advocate Pravin, Dr. Pravin. इतनी अच्छी advocacy कर रहे थे, but सब बेकार थे. Constitution भी ले आए, nursing की definition भी ले आए, सब चीज़ ले आए. I have few questions. And I think those questions will be the answers to why I am sitting on this side. Can we think of this auditorium without the bricks? No. If you ask me, No. We cannot think of a hospital without nurses. And I have been saying it for last so many years in Sarvodaya for last 11 years that for me nurses and with due respect housekeeping are the two most important departments of any hospital. And COVID has proven it that doctors have given e-consultation, the medication has been given at home, but the only common player everywhere was a nurse. So kudos to all of you. Third, can anybody tell any of your star doctor performer what is his first demand? I want good ICU, I want good nursing. ICU without nursing is zero, emergency without nursing is zero. How can we even think about a lesser contribution from a nursing? They are a bigger contribution to any healthcare system. Forget about equal. I was so happy and glad. Frankly speaking, I came blank here when I came here because I did not have to, do anything about it. It was all in mind. It is all in our hearts. It is all in each one of you that you have been contributing to the healthcare globally, not only at Sarvodaya, not only in India, globally. These leaders are proof enough. And I'll just give a little twist, a happy twist. Here at Sarvodaya, we are just not collaborating professionally. Me and Bobby have been collaborating on stage. We have been dancing together, and that is almost a star performance on every event. Me and Bobby have been dancing partners, so that says a lot. I am a medical administrator, she is a nursing director, and we have been dancing. That is the biggest collaboration one can have, even personally. So I don't think so, sir. There is any much hype to be put into it that they are any less collaborators.
मुझे समझ में नहीं आया कि अचानक मैं कहाँ से फोकस में आ गया स्पॉटलाइट में. मेरा अगेंस्ट वाला पैनलिस्ट 4 में बोल रहे हैं, मेरे 4 वाले पैनलिस्ट कुछ ऐसे बोले. आई गॉट कंफ्यूज. पॉइंट इज वेल टेकन, बट नाउ आई एम प्लेइंग डेविल्स एडवोकेट. डिड वी से वी डोंट वांट नर्सेज इन द रूम? नो. डिड वी से नर्सेज डोंट हैव अ इंपॉर्टेंट रोल इन हेल्थ केयर? No. Did we say they are required? No. The question is, are we saying they are at par with the doctor? Now I'm sounding like the against person because I have to fill in for that also. But is the question now, sir, is the medical director in the hospital? Food for thought for all of you all. Medication error होता है, गलती होता है, उसके बाद क्या होता है मैं पूछूंगा नहीं, आप सोचते हो.
कापा होता है, उसमें हम आइडेंटिफाई करते हैं नर्स है, फार्मासिस्ट है या डॉक्टर है. जिसका होता है डॉक्टर का है, डॉक्टर को बुलाया जाता है. मैं आपका प्रश्न समझ गया सर बोलने से पहले. हम हर जगह नर्स को इन्वॉल्व नहीं करते जहां उसकी गलती नहीं है.
करेक्ट. गुड. So before I go to Rekha ma'am, I just wanted to see, we want change. Now if you do it in Sarvodaya, sir, it is very good, but the idea is one, it will not make a big difference. So it is a starting point somewhere. So that's exactly what I'm saying. But now let's go back to Dr. Rekha. You've heard all of this till now. पहले मैं आपके व्यूज बोलने को बोलूं, उससे पहले पूछ लूं, आप उसी साइड रहेंगे या आप इस साइड आएंगे ताकि मैं फिर उस साइड चला जाऊं? नहीं सर, जो मुझे टास्क दिया है मैं उस साइड ही रहूंगी.
रेखा मैम, मेरी आपसे एक रिक्वेस्ट है, अपनी टीम के नाम और फोन नंबर्स दे दीजिएगा, हम कांटेक्ट कर लेंगे.
डेफिनेटली.
ये तो यहाँ पे ओपन कोचिंग होने लग गया भाई. एंड आई थिंक आई शुड कम बैक टू मिडिल. मेरे को साइड में कर दिया गया है.
Sir, for me, nurses are the unsung heroes who never get the credit what they exactly deserving in the healthcare system. So I had to take a few bullets to highlight or to justify my topic. Like, first of all, I just give a point like in the hierarchy systems, doctors are kept at the top and nursing are just the follower of the doctors. So how can we expect the collaboration and equal status in the healthcare systems? Second point is education and training differences. At the perception of the public, doctors and nurses education is a lot of difference. According to public and according to opinion,
doctors get more critical education as compared to nurses. That's why they are easily, or you can say, fit in the decision making and the policy making. That is why the nurse's role as a collaborator and equality are hidden up somewhere. My third point will be the lack of representation of voice in the policy making and the politics. That is the main issue in our nursing profession. That's why our voice was not heard by the administrators or the policy makers or by the administration, because we never heard any nurse in the politics, or we don't have any nursing directorate in the India, neither in the state level nor in the government level, federal level. Apart from that, we don't have any grievance cells to address our grievances. Is it right? We are working in a very infectious areas, but whether we are getting any insurance from the government side, this is a reality, and we are talking about collaboration and equal responsibilities. My fourth point is the patriotic attitude. In the Indian scenario, we are keeping, nursing is a female-dominating field from decades. Though males are also entering in the field, but because the mindset is like that, the female are kept for a, we can say, not allowed to take part in the decision making. It happens in homes also. In the same way, people are just assuming that in the hospital setups, they are to be suppressed by the dominating person in the medical field is doctors. So this is the mindset. We have to change the mindset that nurses also have an equal right to speak and in the decision making. My fourth point I would like to highlight is the scope of practice. You know, we all are educated and we all are having the license. But think about it. How many are really get an opportunity to practice in the real setup, in the clinicals? Is it so we are getting the liberty to practice? Give me the answer. We have licensed, but we are not allowed to practice independently. It's just like a painter is telling to stop painting. It's like a murder of the painter. The same way, think about the mental state of the nurse. She has a caliber, she has a potential, but she's not allowed to practice independently. My last point is the media perception. Did you witness any movie or anything which portray except the role of caregiver in the media? No. So it's a mindset. Media is a very important tool which can prove guilty as a innocent and innocent way guilty. And it's a stereotype of the media that they are not portraying our additional role except from caregivers. They are not showing anywhere that we are also decision makers. We are also involved in policy makings. Apart from that, nursing care, we are also capable of doing lots of collaboration and strategical planning process. So I think I had just pointed out few major points which, without addressing this point, we can't say we are a collaborator and an equal partner in the healthcare delivery system. Thank you so
Madam,
much.
if we say, because आपको ये नहीं बोलना था problem क्या है, आपको तो ये बोलना था कि आप क्यों नहीं मानते कि nurses are equal collaborators.
These are the reasons because they are not working. They are not
I
not
have
collaborators.
little desperate to say something.
अरे सर
मैडम ने
टाइम्स नाउ का वो नहीं बनाना है सर.
एक सेकंड लूंगा.
Okay.
मैडम ने कहा एडमिनिस्ट्रेशन वाले नहीं मानते. पीएम मोदी ने कोविड के टाइम पे क्या कहा? हेल्थ केयर वर्कर्स. He did not mention doctors. He said healthcare workers. और healthcare workers में सिर्फ nurses नहीं थी, even supply chain भी था. Anybody who was working in the hospitals. Second, मैम ने कहा क्या लाइसेंस तो है लेकिन काम करने की आज़ादी है? मुझे एक चीज़ बताइए, KTP, BMT में कौन सबसे ज़्यादा काम कर रहा होता है? Nurses. Doctors are just coming for the rounds. It is mostly the nurses who are doing the job. ICU. When we are talking about CPR, when we are talking about code blue, who's the person who's equally assisting the doctors? किसके CPR पे हमें ज़्यादा भरोसा है? Is it the doctor or the nurse? In my organization, it is the nurse.
सर एक बात बताइए, कोविड में लोगों ने बहुत हाइप किया कि हाँ नर्सेज ने बहुत काम किया, बहुत काम, ताली बजाई और प्लेट बजाई. उसके बाद में कितने लोगों ने उसको टेबल में बुला के बताया कि आप आइए और डिसाइड करिए कि नर्सेज के लिए क्या बेटर है? बताइए मुझे सर.
ये मजा आ रहा है इसलिए मैं बीच में आ नहीं रहा हूँ अभी.
मैडम इसके लिए तो हमें पॉलिसी पे चले जाएंगे, बहुत कुछ मिल जाएगा.
वही तो मैं
नर्सेज के लिए जितना कुछ
लेकिन
हुआ
आप
है.
लोगों का माइंडसेट ऐसे है कि आप बुलाते ही नहीं हो.
और मुझे आप ये बताइए, जब आप ये एक्यूज कर रही हैं तो डॉक्टर्स के लिए क्या क्या पॉलिसी बनाई गई कोविड के बाद? कुछ भी नहीं.
सर डॉक्टर साहब आपने ये बताइए, तो सबको पता है नर्सेज बैठी हैं कि कोविड टाइम में 24/7 कौन अवेलेबल था वहाँ पर, राइट?
नहीं एक whole debate is going southward. It was not about कौन था कौन नहीं है. हमारा आज का मुद्दा, अभी तो टाइम्स नाउ बना ही दिया है, तो मेरे को बना दो कौन था वो होस्ट, मेरे को बना दो. So the question is not किसने क्या किया, क्यों किया, कब किया. The question is ये दो कैटेगरी के लोग, do we consider them equal collaborators and partners? You are saying they are not because of A, B, C, but you are saying you are not. And you are saying yes we are, and you cited that. Correct? Yeah. You wanted to say something?
Yeah, I want to answer to Dr.
How mild she
First,
sounding, no?
then I'll
How
come back to
mild you
your-
are sounding compared to what I was going on.
No mind. So in the model, just now you said collaboration, the definition. Totally agree. So you said people working together towards a common goal. Exactly. The entire nursing fraternity is working towards only one goal. Whether the patient is in acute stage, in the hospital, out in the community, in the home, wherever it is patient care. Quality, high quality patient care. I think doctors, nurses, all of us, this is the only thing in our mind, whether it is a pandemic, whether it is a specialized unit, or a patient sitting in a counseling room before a transplant procedure, or a dying patient. All of us are towards one goal, that is that appropriate situation in the clinical setup, the best of care. I think in that arena, in that mode, all of us are in equal situation, one goal, that is quality care. Answering to you, whether it is public, private, community, all of our thoughts are the same. Now, Rekha, you are talking about practice. Practice, who makes best practice? The nurses. Who makes best practice? The nurses. I have a question to you. How many nurses actually take extra efforts in upgrading their own practice? We nurse administrators, I'm sure many of the in charge sitting out there agree. In the morning you heard that people come on board. The nurse administrators are dying hard to make opportunities for them. Whether preceptorship or those kind of trainings are over, your continuous development, the kind of trainings happen throughout the country, conferences, workshops, webinars. How many of them willingly sit and learn and upgrade? You need to be skillful and competent to practice. So the will and the desire has to come. But today the opportunity is given to nurses, same as doctors. Today also we are seeing from morning nurses, doctors all listening to each other. So I think the opportunity is there. We need to just grab it and move forward if you want to make your own practice better, whether in specialized area or otherwise. Now nurse practitioners course. Nurse practitioners course is available in India. It is in the baby stage. Few organizations are running the course. Now we have to think of creating opportunity for them. Better salaries, better benefits, because they have put a lot of efforts in that scene. Coming to COVID-19, how nurses were, whether they were taken care or not. Entire nursing leaders and the top management, medical administrators, medical directors, they were all praised for the nurses. What not done for them? Extra leaves, break time, making sure they have proper PPE,
Okay.
they are taken care.
I'm not denying, ma'am. I'm not denying what you are saying, but my point over here is that after COVID, how many people are called nurses to come forward and just make a policies? What are the things to be add up in the if there's something happened like the COVID in the future? How many people are called the nurses? Is there a tendency to get their benefits and forget after that?
I'm coming back. I have to now put my authority as the moderator of the debate and comment to this. Dr. Pravin, you wanted to say something? A minute, because we are running on just time.
It is not at all so complicated. I will tell you a very simplified way. These are all roles which are played by different individuals. There are definitions of roles. A doctor, a clinician, I'm doing a medical role, as I correctly said. A nurse is doing a nursing job. Going a step further, when I talk about collaboration, equal partners, it's just not doctors and nurses alone. The janitor who is cleaning the toilet of this hospital is also a collaborator and equal partner. There is no one exempted. There is no one job which is above or below the other. That is why, going a bit philosophical here, when we come to the essence, as a human being, one human being respecting the God in the other person, saying Namaste, we live that every moment, considering our culture. And there ends all these debates because we are all going to be equal partners. But the question is, are we? It's a philosophical, political, sociological, different questions come. Gender, sexism, biases,
डॉक्टर प्रवीण के साथ बैठते हैं ना तो एक डिक्शनरी भी लेके बैठना पड़ेगा. It is good. One second. You know, in the interest of time, you know, we have to cut it short now because see, Bobby, one thing for you first. ऐसे डिफिकल्ट सेशन मत रखो जहाँ यू नो बहुत इस साइड उस साइड हो जाए कि वो वाले कैंडिडेट भी इस साइड आ जाए. एनीवे सी तोड़ दिया. कार्डियोलॉजिस्ट है कहीं आसपास?
अभी मैं यही कह रहा था कि ये गलत लोग हैं.
नो गलत.
सर रियलिटी ये है कि जो हम बोलते हैं वो फीड पे नहीं दिखता.
करेक्ट. सो सी एट द एंड ऑफ द डे व्हाट इज इम्पोर्टेंट इज यू नो वी ऑल लिव टू लाइव्स. One is the life we are here, and one is the life on the ground. Now, I was always looking like I was here, but actually, in the fact of the matter is, no matter कितने debate हो जाए, no matter कितनी बड़ी बातें हो जाए, we all know how nurses are treated on the ground. Do you agree? अभी आप सब लोग तालियां इधर बजा रहे थे क्योंकि they are saying what I wanted to be, correct? Which exactly means it is not like that today. And it is not like that today for multiple reasons, and the whole endeavor is we need to take it there because see, housekeeping is also collaborative in care, but do you say equal partners? Gray area, we don't even go there, you know. Anyway, now we have last 1.5 minutes to each of you. So given a chance, you know, that wish list, the wish list you could do something differently. 1.5 minutes, what it would be that you would do differently to go to the place we want to go. Make them equal collaborators. 1.5 minutes.
1.5.
Yeah.
No problem. See, I think wish list can be very long. Today, if nurses are happy, means with my long experience, I have seen remuneration plays a big role. Remuneration. People want good money, good salary. Though we say that, you know, it is not the salary alone that matters, it is the environment. People they give interviews in 10 places and choose the place where they are getting more. Because their target to stay in the organization is 2 to 3 years. I'm talking about the youngster. So give them good pay for their work. Specialty nurses, wherever they are, they have to be posted and recognized and paid well. And training standards have to go up. Training, just generalized training at the time of induction, that alone will not work. We have to relook into our specialty training programs. Is it really happening? Are we really testing their competency? Then rewards and recognition. There are many nurses working very, very hard. As she said, that are they getting recognized? I think more opportunities should be given to people of at all levels. Not only the beginners, the mid-level managers who have worked in the organization for a long time, rewards and recognition.
So what I heard was Josephine saying.
And the last is decision making. They have to be in the policy making, in the boardroom, bedside to boardroom opportunity should be given.
So
that is what my dream.
So आप 4 पे होते हुए भी अभी last point में आपने goal post change कर दिया.
You told me what is my wish list.
Yeah, so that means we are still not there. Yeah. Correct, and that's good. You know, pain management is okay, specialty nursing is okay. This is very, you know, Captain Usha talked about the pie and the size of the pie in the morning. Yes, from your side, what is it that we need to do differently?
Should versus are, the question is, are we? No, we are not. But at the same time, I just want to say that these elements are based on mutual respect for each roles played by everyone in the healthcare field, as Sir rightly said, healthcare workers, whoever is in that chain. And also give respect, take respect. Reciprocity. If suppose somebody you don't get respect, you ask for it, demand it. Otherwise, don't give respect. Take respect and give it. And also trust. An element of trust when it comes to every human being. We should have an element of trust and build the trust. And this is how we go.
I think this is a very interesting and important message. You know, considering someone equal, what does it actually mean if you look at it objectively? I think this is the first time मेरे को dictionary का जरूरत नहीं पड़ रहा है. Give respect, take respect, trust. You know, these are the 2 things we need to take out of it. What about you, sir?
So I think ऐसी conclave की बहुत ज़रूरत है जहाँ पर लोगों का दिमाग खुले कि ज़िंदगी में और लाइफ में और नर्सिंग फील्ड में, मेडिकल फील्ड में क्या क्या हो रहा है, what all is happening. So the very exposure I feel in the nursing fraternity is filtered, is not reaching to the last level. And I think that is where we need to work, because a lot of nurses, new nurses, do not have those aspirations because they do not know where they can reach. And I think the government, the policymakers, the healthcare people, all of us will have to work together towards that.
वंडरफुल. सो दिमाग खुले, लेकिन मैं सोच रहा था दिमाग के साथ दिल भी खुले, जेब भी खुले, सब खुले. राइट? करेक्ट. सी दे लाइकिंग दैट बेटर विद द पॉलिसी मेकर्स. मैम, योर 1 minute.
Apart from the words spoken by my colleague, I just want to add one more thing: open communication. It was lacking in the nursing profession. We have to sit together, find out the flaws where we have to work on, and try to overcome the hurdles, so that we can really collaborate in the healthcare systems and take a decision-making process. Thank you so much.
Great, great. So we still have 2 minutes, so let me sum it up as, this is the first easy one, so कुछ करना ही नहीं है. But should, sir, you're contagious, you're infectious. Abhi I have also come into the should, then could, then is it. But are nurses treated as equal partners in healthcare today? Audience, yes or no? जोर से बोलो, नहीं तो सुनेंगे नहीं. So there is no two doubts about it, and so a loud round of applause for this side, जो against the other thing, है ना? Okay. Should nurses be treated as equal collaborators and partners in healthcare? Yes. So a loud round of applause for them also. Now, they said Rome was not built in a day, but I will say it did not take ages also. So it is conferences like this, it is forums like this. Only the attendance have to be more CEOs, more doctors. हम trust का बात कर रहे हैं, equal partners का बात कर रहे हैं. We are basically talking about one fraternity only, who we sadly represent. Respect comes from there. Mindset change is not about कि यार we are equal partners. Do we respect them? Do we give them time? Do we talk to them? There is no constitution rule which will come that they have to be equal partners. So I think this was a wonderful debate, and this will go on as things go, as years pass. I am very confident. And someone said in the morning, Mr. Agarwal said, that 20, I think Commander Bali said that 10,000 jobs in Germany only. Don't go to Germany. There are a lot of jobs here. And this is a good place. Captain Usha said in the morning that by virtue of JCI, I go here and there. I've been to 45 countries. I'll tell you one thing. The work we do here and the type of things I've seen here, it's difficult to see anywhere else. हमारा एक problem होता है, हमें volumes मारते हैं. So healthcare in India is good. It's great. It's got a good future. Should the nursing fraternity be recognized more? Yes, there is no doubt about it. Is it going to be easy? No, let us be realistic. But conferences and conclaves like this will help us to get there. We have time for one question from the audience. One. Sir, Chairman sir. This mic.
I got one very small comment to make about this equal partnership or feeling of equality. It will again come with meritocracy. The more empowered a girl nurse is, the more respect he gets automatically. The consultant will look for that particular nurse who can help her in emergency situations, who can put the PIC line, who can put the difficult cannulation, who can do the difficult jobs. So you earn respect by your values, you develop in yourself. That is one part. The second is, we have been saying time and again that this conference hall is not having many non-nurses. I am telling you that this is the beginning of the journey. Next time, whenever you have such conclaves, give us time to clinicians. Have selected topics for them of their interest where they need to collaborate with us as consultants versus nurses. I am sure you will have hundreds of clinicians sitting over here and they will be equally interested in talking to you and sharing their quota of problems or difficulties with the nurses and vice versa. So that will become a good forum then. We have just started the beginning that we are having nurses conclave. Somebody is trying to look into the problems which nurses face. Somebody is going to give you a roadmap as how to improve nursing in India. So this is the beginning, and you will be remembering someday that okay, we had that foundation conclave here in Sarvodaya 10 years ago or 20 years ago.
Thank you, sir. So at least इससे दो बातें तो confirm होगी. 10 साल बाद मुझे बुलाओगे. No, I said very rightly said, and if I have to sum up what sir said, they said एक कहावत है, with great power comes great responsibility. So, we are talking all of this. I think you need to, now start shouldering responsibility also. And, meritocracy, this is a new word we made today, but it's good. Thank you. And before I end, I want to wish all nurses happy Nursing Day for 12th of, it's on 12th, right? So happy Nursing Day to all of you.
Thank you so much, sir. And what a wonderful and powerful debate that we have enhanced out here. So to take this forward, this powerful debate, we have another one video for all of you. Stay connected with us. Light cam. After this powerful debate, may I request all to have a powerful applause. Ms. Josephine, Cyrill. Clapping रुकना नहीं चाहिए. Thank you. Dr. Pravin Thomas. Dr. Saurabh Gahlote. I request all the panelists to stay back on stage. Would like to invite Dr. V.R. Gupta sir on stage to felicitate our moderator.